All right. Hello, everyone. Before we get started, I'd like to thank you all for logging on to this seminar. I'm Dr. Michael Florek, and I am very happy that all of you are able to join us this evening for a discussion on marijuana as medicine. I'm a physician specializing in osteopathic neuromusculoskeletal medicine, and I perform a variety of interventions ranging from non-surgical orthopedic procedures to osteopathic manipulative medicine, and of course, medical marijuana. I am the Associate Director at Manhattan Medicine, located on 300 East 56th Street, which is right on the corner of 56th and 2nd Avenue in Manhattan. I'm happy to answer any questions about the medical services the practice offers and explain the principles of osteopathic manipulative medicine at the end of the discussion. But before I get to any questions, I'm going to present to you all the concept of medical marijuana and how this medication can help you. Today, we're going to go through some broad strokes, but the biggest topics will include conditions that can be treated, mechanisms of the medication, risks, addiction profile, those things in comparison to other drugs, comparison to over-the-counter pain medications in general, as well as comparison to opiates. And then we're going to end with a couple examples of patients who have been successfully treated with medical marijuana. And last but not least, we'll talk about how you can get access to this medication. There will also be a period for questions at the end of the discussion. We are asking that you respond in the YouTube chat, or you can always text into our Manhattan Medicine phone line, which is 212-935-1700. And again, the number is 212-935-1700. This is also the number that you guys can call tomorrow if you're interested in scheduling a visit to discuss your health conditions and learn how medical marijuana can help you personally. For anyone who does plan to call in, mention that you have seen this seminar and you will have a discounted rate for the medical marijuana recommendation. Now, there are a wide range of conditions that qualify you as a patient to receive medical marijuana. And my specialty lends itself very well to many of these. But of course, there are things on this list which are outside of my specialty. And I would expect the patients are following with another physician for their more traditional pharmaceutical medical care. While I may not be able to manage the underlying condition that qualifies you for medical cannabis, I am very comfortable coordinating with your subspecialists to help balance medical marijuana with any current medications or underlying medical conditions. I've seen firsthand how patients are able to decrease or even sometimes eliminate certain medications while using medical marijuana. But for that to be done safely, it requires someone like myself to manage the medical marijuana side by side with your other physicians. At many other clinics, recommending physicians will act only as gatekeepers to the medication. They will simply identify that you have a condition that meets the criteria for medical marijuana, and then management will stop there. Getting back to this list, though, what I'm most interested in talking to you guys about is chronic pain and similarly associated conditions. Now, because of my specialty, I typically see patients who suffer from arthritis-related pains, injuries, sprains, strains, nerve injuries or neuropathies, and chronic muscle spasm-related pains. All of these issues can create an environment where patients suffer from pain on a chronic level. Now, many of the things on the list that we just saw, the diagnoses are either black or white. So you qualify or you don't. However, pain is a more subjective complaint. And someone like myself who sees patients who are in pain daily, it makes me very happy that this medication exists because it offers what I would consider a relatively safe alternative to both addictive opiate medications and or invasive surgery. Moreover, when you have chronic pain, you're not plagued by just one problem, but all of the secondary complaints that come along with chronic pain. When everything hurts, you begin to develop anxiety around that pain. Often patients can't get a good night's sleep and they've got insomnia because everything hurts. We take too many ibuprofen or Aleve or other anti-inflammatory medications that cause gastric stress, or we use too many opiates, which leads to decreased effectiveness, tolerance. Not to mention, if you don't do anything at all, you'll create an environment of inflammation within your whole body, and that will create many downstream complications in the long term. Now again, medical marijuana is in many ways an ideal medication because the chronic pain and its secondary problems of insomnia, anxiety, complications from NSAIDs or opiates can all be managed and helped with medical marijuana. Now, what is medical marijuana? It is an organic compound, and like all organic compounds, it is made of much more than just one active ingredient. When we think of most medications, you have one specific compound that has been very specifically synthesized to be administered to you. With marijuana, you have two major compounds, and you may have heard of them before. There's THC and CBD. And there are also countless secondary compounds which act to enhance or balance the effects of CBD and THC. And these fall into a category called terpenes, which can add to the profile of a specific strain of marijuana. Now, we could have a whole lecture on terpenes specifically, but for today, I just want to introduce these compounds so that people understand that there can be some variation between strains, even variation within the same strain based on the profile of the plant from which it was harvested. And I want people to keep in mind, especially if you've had a bad experience with medical marijuana in the past, that you should try and keep an open mind, because the results might not always be consistent, and they might not even be consistent with strain to strain, especially if you're not getting that medication from a medical distribution center. Now, getting back to the two major compounds, CBD and THC. These two work together to act on cannabinoid binding sites, which exist throughout the central and peripheral nervous systems, as well as our body in general. THC acts mainly on the CB1 receptor, which are predominantly found in the brain and the peripheral nervous system, while CBD will act more on the CB2 receptors that are located diffusely throughout your body and within your immune system. People will typically use CBD to help treat a variety of conditions, such as inflammatory bowel disease, seizures, depression, inflammation in general, psychosis, mental disorders, and migraines, while THC has potential uses in treating things like glaucoma, muscle spasticity, low appetite, and insomnia. And the combination of these treat pain, anxiety, and nausea. When I say the combination, I mean each one of these medications individually treats pain, anxiety, and nausea, but much more than either one is effective individually, they are more effective when taken together. And this is a concept called the entourage effect, where alone, each of these compounds is helpful and the results are measurable. However, when we take the two together, the effect will be greater than the sum of the parts, meaning that CBD medication that you find at most retail stores can be very helpful, but it's not nearly as effective without its THC counterpart. So CBD will decrease inflammation in the area, while THC reduces muscle spasticity, but both inhibit overstimulated pain fibers. And this is the main reason that I recommend medical marijuana as opposed to CBD independently. Now, because we have so many cannabinoid receptors in the brain as well as in the body, you can imagine that there are many treatable conditions. What I will be discussing is how chronic pain can be treated with medical marijuana, either as an adjunct to medication or as an independent treatment. You probably remember from the initial slides, chronic pain is one of the conditions for which medical marijuana can be recommended. And in fact, it is the most common diagnosis used for the recommendation of medical marijuana. This is because medical marijuana is effective at treating two important different causes of pain. The first of which is inflammatory pain, which is associated with problems like arthritis. And the second is neuropathic pain, which is due to overstimulation of the nerves in a given area. And it is common with neuropathies, post-surgical pains, and even chronic injuries. Cannabis manages chronic pain in part by preventing pain receptors from firing and sending signals to the brain. Inflammatory pain occurs in response to tissue damage. Pro-inflammatory substances will lower the threshold for nerves to send that signal, telling the brain that the body is in pain. When we use cannabis, the cannabinoids bind to these pro-inflammatory substances and prevent this inflammatory cascade. Neuropathic pain results from any kind of lesion to the peripheral nervous system, such as anything in your extremities, or damage to the central nervous system, which would be seen in any kind of spinal cord injury or stemming from a condition like multiple sclerosis or a stroke. Here, cannabis actually blocks the release of neurotransmitters that would normally send a signal telling the brain that there is pain. So if you look at the image over here, we can see little spikes of nervous excitation. So every time there is irritation or pain, there is a tiny release of a compound that will eventually build in the nerve and send a signal. It is not until there is enough of these excitatory spikes that we reach a threshold and then send that signal along the nerve. With cannabis, we're able to limit the release of these excitatory compounds within the nerve, making it harder for the nerve to send signals to the brain. And this is true both in the peripheral nervous system as well as in the central nervous system and the spinal cord, meaning there will be multiple checkpoints where pain signals can be dampened. So now that we know a little bit about how the medication works, you might be wondering what makes this a better option than opiate pain medications like Percocet or oxycodone. The first and most obvious answer for me is that, as far as I am aware, there have been no known fatal overdoses from medical marijuana. For this reason, I would say that cannabis will decrease pain, and it will do so in a way that can be much safer than opiates. Well, this is not to say that it's not totally without risks. I would say that those risks are much lower when compared to opiate medications. I have seen that opiates are very successful in short-term pain management, but I would argue that medical marijuana is actually a better option for treatment of long-term pain. In addition to having no documented overdoses from marijuana, there is a much lower concern, no documented fatal overdoses from marijuana. There is a much lower concern for creating dependence to medical marijuana, unlike opiate medications. While opiates are considered a much more potent painkiller, they have no antispasmodic effect, and there is no anti-inflammatory component to these medications. Finally, for patients that are already using prescription opiates, medical marijuana is still a very effective adjunct to these medications. This means that medical marijuana given in conjunction with opiates will decrease pain more than taking either opiates or medical marijuana alone, which is why I'll typically recommend to all of my patients who are already on opiates to consider adding medical marijuana to prevent the consistent and stepwise increase in opiate dosing. So when we look at the use of over-the-counter pain medications, something like Advil or Aleve, these medications are very effective at reducing inflammation, but the chronic use will cause GI distress and eventually acid reflux and ulcers. Marijuana will not cause any of these symptoms, and in fact, the simultaneous use of medical marijuana with NSAIDs like Aleve or Advil will limit GI distress caused by the drugs, and it will further the anti-inflammatory effects that those medications already have. Now, in 2020, the Harvard Gazette published an article which shined light on some of the myths surrounding cannabis, and it also addressed safety and addiction concerns. Professor Kevin Hill pointed out that there is still more to learn, but many myths of danger have been disproven. However, the loudest voices, either for or against medical marijuana, happen to be the most extreme. This is seen when you have a pro-cannabis individual that says that it's the greatest medication ever, it treats everything. And then you have the anti-cannabis proponents that say that it's a dangerous medication that should be categorized similar to heroin or fentanyl. He then goes on to discuss that cannabis is in fact less addictive than alcohol or opiates, but that does not mean it's completely non-addictive. With that being said, the withdrawal symptoms from cannabis are very mild, and I've personally never had a patient who notes any problems with abruptly stopping this medication. We get into trouble when younger people are using this medication in high volumes multiple times a day for a prolonged period. This is how this less harmful and less addictive substance can cause problems. My biggest concerns involve these younger individuals, specifically minors under the age of 18, who are using large quantities, unsupervised, over prolonged periods of time. And this kind of use has been shown to cause IQ decline in juveniles. Now, I know this fact can be scary for some, but keep in mind that this patient population is still in the developmental phase of their life. There is a very low risk for an adult to have any kind of long-term cognitive issues if they're using medical marijuana responsibly, and especially under the supervision of a physician. In adults, my biggest concerns are that patients may experience symptoms of very mild paranoia or anxiety. Sometimes patients feel a little depressed or down, and they may have very mild memory impairment, but only during the period that they're using medical marijuana. And I mitigate these to the best of my abilities by explaining these risks as well as any other potential concerns. And I am sure to advise patients to begin with lower doses of the medication so that we can identify any possible side effects. And then, as long as there are no side effects, we can slowly increase the medication as the patient needs. So I'd like to point out a few articles. Here we have one that explains a double-blind study that examined the use of THC administered as Nabilone on fibromyalgia patients. So these patients were either given a placebo or they were given medical marijuana at 2 intervals during the day. After a 4-week trial, it was found that the THC was both well tolerated in the fibromyalgia patients, and it had significant benefits in pain relief as well as functional improvements, while the patients that received no THC saw absolutely no change in either their pain relief or their functional improvements. Here we have another double-blind study that examined response to THC in patients with fibromyalgia-related pains and an accompanying sleep disorder. The primary focus of the study was on sleep. And not only did it find that these chronic pain patients had more restful sleep, but they also had reduced pain, improved mood, and improved overall quality of life. And the last study I will note involves the effects of cannabis extract on mice. It was observed that mice who had naproxen-induced gastric damage, that would be Aleve-induced gastric damage, the cannabis was successful in reducing pain associated with this damaged tissue. It also reduced inflammation around the tissue, and it promoted a healing environment for that same tissue. It was then concluded that cannabis not only helped with pain and inflammation in these animal models, but also that it could prevent injury from what would otherwise occur in a non-steroidal anti-inflammatory medication. So now that we've learned a little bit about medical cannabis, we've seen a few studies, I want to discuss a few success stories. The first patient is a 49-year-old female, and she suffers from chronic pain, neuropathy due to cervical spine impingement. There were secondary complications of insomnia and anxiety due to her pain, and the patient was waking up nightly due to the pain and the numbness that it was causing going down her right upper extremity. The pain was terrible in the evenings, and she was getting severe anxiety around the pain. She was concerned that she would never find relief, and the patient was even considering surgery for her cervical spine. She had undergone multiple attempts to manage her pain through various drug therapies, chiropractic manipulation, and repetitive nerve blocks. And all the therapies had only offered partial or transient relief. So prior to going to the surgeon, she had attempted medical marijuana, specifically a combination of the topical medication, oral drops, and oral capsules. And the combination, was tailored to her insomnia as well as her chronic pain. So immediately, The patient found that the medication helped with both the pain and the insomnia. She's now able to sleep through the night without pain or numbness in the arm and the hand. Her neck pain is down from about an 8 out of 10 to about a 2 out of 10 on average, and she is able to fully function with reduced pain and reduced anxiety. Her neuropathy is now only present 3, maybe 4 nights a month, and the patient now presents to our office for osteopathic manipulative care to reduce the physical component of her pain, and she receives intermittent nerve blocks to help with any spikes in the pain, and she is easily able to subdue her pain in a very consistent fashion. When we control pain for this patient, we're able to better focus her treatment on the root cause of the problem, so that eventually we'll be able to reduce the medical marijuana as well as the other interventions so that she can live pain-free on a daily basis. Our next case is a 78-year-old woman who also suffers from chronic pain due to severe osteoarthritis in multiple joints. This includes bilateral hip arthritis, knee arthritis, and shoulders. Her pain also causes anxiety and secondary problems of insomnia. Things have been progressively worsening for this patient over the last 10 years. She was unable to take any nonsteroidal anti-inflammatory medications like Aleve or Advil, and due to secondary health complications, she's unable to have surgery. When previously asked if she would consider opiates, the patient refused for fear of addiction. She sees physical therapy 2 times a week, and she gets moderate relief from physical therapy, but she's looking for more. She decided to do a trial of medical marijuana about 6 months ago, and she was started on a combination of oral and topical medications. The patient initially began with the topical medication and had a mildly positive response to treatment. So when she found herself more comfortable with the medication, she began to incorporate liquid medical cannabis and oral capsules. The combination of these therapies was able to give her a more sustained and consistent relief of her arthritic pains. She's now able to find relief for longer periods between her PT sessions. She has also added osteopathic care to her treatment protocol, and she is doing much better overall. Now, I chose this patient to illustrate that some patients will require a little bit more medication, and depending on the severity of the pain, there may be mild lingering discomfort. But what the marijuana does is it puts us in a position where we can better manage that pain, and we can take advantage of the patient feeling better so we can incorporate more treatment to accelerate their pain reduction. So, what can we do to make the most of your care? So obviously, you're going to come to us and we are happy to give you a medical marijuana recommendation if you meet the criteria for chronic pain. But during that time, we also want to highlight that the pain reduction will give you the ability to explore other options for pain control. Physical modalities like chiropractic care, acupuncture, osteopathic manipulation, massage therapy, and these are all things that our practice offers. We want to make sure you're making the most of your time with us, and you're making the most of the time that you're pain-free, aided by medical marijuana. Here we have just a few references. For anyone that's interested, we have the studies that were referenced, as well as the references for the article from the Harvard Gazette. And these will be up for anyone to view later. And finally, I'd like to take a little bit of time and open up the floor to some questions. So if anyone has anything they'd like to ask, we're going to check the chat and see. Okay. So does anyone have any questions either about osteopathic medicine, medical marijuana, treatment protocols, anything that anyone's curious about? Because I can go on and on about this. Let's see. So I don't see any questions yet. So something that a friend talked to me about the other day that I thought might be smart to bring up was, what's the difference between the medical marijuana that you're getting at a dispensary versus the marijuana that you may find in other avenues of society? Now, in New York State, there are laws which guarantee that the people that are selling you the marijuana from a distribution center are also overseeing the growth of the plants. They're making sure that the soil is tested, the fertilizers used are all compliant with the FDA. And this produces a very consistent strain so that when you go to get your marijuana from a medical distribution center, you will have a very consistent pattern. So if you know something works for you one time, you're going to see that that strain consistently works for you because there aren't a lot of cooks in the kitchen changing things around. There's a very streamlined and safe process. Not to mention, with these medical distribution centers, they're held to much higher standards. The state is actually observing it, every link of that chain, to make sure that the marijuana is safe and effective, and you're not getting anything that's dangerous. Let's see. Another thing that I thought I'd talk about is how we typically dose patients. So I like to start with as low a dose as possible with the most non-invasive forms of medical marijuana. I'll often give patients topical medication first to see how we can move just with the topicals. This medication is great, especially for patients who have never used medical marijuana before, because the medication is only absorbed locally. When it's absorbed locally, you have to worry less about any kind of systemic side effects, like any kind of paranoia or anxiety that might come. And once we know patients do well with a topical dose, then we can go on to an oral dose, which may have more potent effects, which may be necessary. But this way, we can slowly work patients up to that. Okay, so I see we have a few questions coming in. So how does medical marijuana help with migraines? So medical marijuana, like we mentioned earlier in the presentation, it's very helpful at limiting the way pain signals are sent within the body. So when you have pain like a migraine, there is a central nervous system issue where your brain is sending spikes, that there's irritation within the brain. Those spikes send signals throughout the brain, and that overstimulation causes a migraine. With medical marijuana, the way it controls pain is that it dampens those spikes and it binds to the cannabinoid binding sites, which would otherwise be releasing more of those pain signals. So decrease in pain signaling causes decrease in nervous excitation, causes less of a response within the brain, so you don't get that electrical activity that causes migraines. Let's see. Next question, what type of topical would we recommend? So that's a very good question. There are several different kinds of topical marijuana. Now, we can have a high THC profile or a high CBD profile or an equal CBD-THC mix. Just like I was saying earlier in the presentation, I really love the combination THC with CBD because those two together will give you the anti-inflammatory component, the antispasmodic component, and they work against each other to improve pain control in general. Let's see. Next question. So the next individual is saying, we mentioned benefits of buying from dispensary versus a neighborhood drug dealer. And, oh, glad to hear that the former is better than the latter. But is there a difference between strains? So yes, there's going to be a difference between strains. No matter who you're buying from, one strain will be very different from the next. And the reason for that is, like I was saying, the combination of THC and CBD will balance differently with each medication or with each plant. And then we have a whole terpene profile. Those terpenes are those secondary compounds that are going to add to anxiety relief versus making you a little more hungry or a little more sleepy or helping more with pain control. There are others that will give you a little bit more energy and even help you focus. So strains will be different, but if you find a strain you like, such as purple haze or lemon haze, you can count on those being quite consistent, especially if you're getting them from the same dispensary, because their grow process will be consistent from start to finish. So by the time you get the end process at the dispensary, you're going to have a very consistent product. Let's see. Indica versus sativa. So let's talk a little bit about indica versus sativa. So indica is your in-the-couch strain. It is typically better for pain management, in my opinion. It's better for insomnia, and it's better for anxiety-prone patients. It will decrease your chance of feeling anxious with marijuana and give you the pain control that you need. Now, sativa gives you a little bit more energy, and it's something that's very good for daytime use if you need medical marijuana during the day. Let's see. Next question, is liquid prescribed more than pills? So typically, I like to go in a stepwise fashion. So that first step is the topical marijuana. After a patient acclimates well to the topical medication, what I'll often do is incorporate some kind of oral drop, something that's small and it's a very low dose. So one droplet will usually be about 5 milligrams of a combination THC and CBD. Those oral drops are fantastic because they're easy to take, they're a small dose, and they take about 30 to 45 minutes to kick in, and they'll last for 3 to 4 hours. So I like to start with those first because it's easy to titrate up or down. And if you take a little bit too much, the medication will be out of your system shortly. Pills, on the other hand, such as the capsules, they typically come in slightly larger doses. About 10 milligrams is what they start at. And those pills can take 2 to 3 hours to kick in. And then once they have, once they've started, you may feel the effects for as much as 10 hours. So they're very, very helpful for long-term control of pain, or if you want to take a medication that's going to get you through the night with a very comfortable slumber. But I would say that that's for a patient who knows how they're going to be responding to both the oral and the topical medication. Let's see. Where's Susan? So the next question is, why would people be hesitant on taking medical marijuana versus other medications such as opioids, which have dangerous consequences? That's a good question. And I think that goes to what we were saying about the loudest voices in the discussion about medical marijuana are the ones that are on the extremes. You've got some people telling you that it's the best medication in the world and there's nothing to be concerned about. And then you have others who are saying that it's the worst medication in the world. And that kind of polarized opinion creates an environment of fear because people hear two very different stories and they don't know what to believe, which is why I'm trying to be as honest with you about all the benefits, but also keeping in mind, like with any medication, there are some risks. Now, opiates have been around for a long time, and I think patients feel comfortable with a medication that's been consistent in our medical society for so long. Medical marijuana is brand new to the block, but we're taking steps every day on the federal and local government scale to move towards more legalization for more opportunity for patients to have access to the medication. And I think as doctors like myself are more open about the benefits of this medication, patients are going to be more comfortable coming in and asking for it as an alternative to their pain management. Let's see. And I think we have one more question. What type of application is the fastest for relief of pain or anxiety? So the fastest relief with medical marijuana does come from the flower itself and to vaporize the flower. Now in New York State, we only allow for the use of the flower to be smoked if it's being smoked through a vaporizer. Now a vaporizer is not a vape pen. This is something different. A vaporizer is a tool that heats the medical marijuana to a temperature that combusts only the THC and the CBD and the terpenes that are present in the marijuana. What that does is it limits the amount of carbon that you're taking into your lungs while you're inhaling, but it provides the fastest and most direct method. This is a method that I would typically hold off recommending for patients initially because I want to see how well they do with marijuana as far as topical, tinctures, and oral capsules. But it is a very good option for patients, and I would be happy to explore it with any of you if you're curious and you want to come in and talk about that. Let's see. I think that's all the questions that we have for today. So up on the screen, let's see, I'm going to try and make this a little bit larger. So up on the screen, we have the phone number to the office, 212-935-1700. I'd love to talk to all of you more about any personal questions you have about medical marijuana. And I'd love to see you in the office to discuss medical marijuana, osteopathic care, or treatment of any pains that you might be having. Okay, so I'd like to thank everyone for joining us today. It was a pleasure speaking to you all. I hope you have a wonderful night, and I hope we hear from you soon. Oh, and don't forget to mention that you were a part of this seminar, because we'll give you a discounted rate for the medical marijuana when you come in. Thank you, everyone, and have a wonderful